Good afternoon, everyone. I'm Sandra Arevalo, Director of Community Health and Wellness at Montefiore Nyack Hospital. And today we continue talking about diabetes because November is Diabetes Awareness Month. So we're going to close strong today. We're not going to be here next Thursday because it's Thanksgiving, but we want to close the month strong because we know that diabetes affects a lot of people. So we had some series this month of November, and today we're going to be talking about the secret. What
The
is it?
factors that sabotage your blood sugar.
Thank you. Secret factors that sabotage your blood sugars. So you know that a lot of people struggle with blood sugars, and we emphasize all the time about diet, diet, diet. You need to eat this, don't eat that, etc. But then Nancy Quiroz Gomez is here. She's one of our health educators at Montefiore Nyack. She is going to tell us about many other different factors that actually can affect your diabetes. And we might not know about it, or maybe we know, but we don't know why. And I think that one of the reasons behind diabetes is that when you know how things happen in your body, it's easier to learn to control it because you understand it. So, Nancy, thank you so much for being here. And we're doing this again with Nancy this evening. So, thank you for doing it twice, not only once, but twice today. And the ground is all yours. So, if you want to just share your screen, if you have your presentation.
Yes, I do. Let me just share that and let me know when you see it. You know that you see that?
Yes.
Okay. Slideshow. All right. So this is
We
my
are hold on, we're seeing the
see. Can you see the diabetes screen, the presentation?
yeah, we do, but if you want to make it bigger,
That's
we
what
were
I'm.
seeing your notes screen.
Oh, that's weird. Okay, let me slideshow and from beginning. Does that? Can you see that? For some reason, it's showing up this way for me. Let me switch it.
I can see it right now.
Does Can you see that screen?
No,
Why does it show this way? Uh, I only see the slideshow on my end. I don't see the. Hmm,
we don't see anything.
that's so weird. Okay, let's try one more time. I'm sharing the first screen.
We did before, but
Is that
okay.
working?
Yeah, we see it.
Okay.
Yeah,
If I do that, does it change for you?
no, we're still seeing your notes.
I don't know why it's coming up as a note. Okay. I can't for some reason it won't let me.
If you have two screens, you might be showing uh you need to show the other screen.
And that's exactly what I did. I'm showing the first screen, not you, and for some reason it doesn't let me. It shows entire screen. Um,
Okay.
I'm sharing this particular screen is the one that I'm sharing, and then when I open it to play the one screen, it goes into notes. I'm not sure why. Let's see. Let's try it one more time from current slide. Let's see if we can make this any bigger for you. My apologies. Better?
Yeah, that's great.
All right. So, good afternoon, everyone. My name is Nancy Quiroz Gomez. I'm one of the diabetic educators here at Mountainside, listen to me, Montefiore Nyack Hospital. We're going to discuss today the secret factors that sabotage your blood sugar. Most people are familiar with the basics. So, they tell me as an educator, I eat too much sugar, my blood sugar goes up. If I don't sleep well, my sugar goes up. Or if I'm not eating or taking my medications at the right time, my sugar goes up. There's actually a lot more that plays behind this. And we really want to discuss the bigger picture, right? To give you a better understanding that it's not just one thing that affects your sugar. It's not just eating candy or you're eating too much or maybe not eating enough, correct? So I want to show you, did you know there's other factors such as stress, illness, exercise, medication, and also your sleep. All of this plays a bigger part in what diabetes could look like. We are normally taught, as you could look at the picture, excess of food, maybe obesity, a family history, your age, and even having a sedentary lifestyle Yes, they do play a part in diabetes, but again, they do mention stress briefly, but do you know there's a little more involved in the stress? There's hormones behind that that we'll discuss briefly that affect your numbers, okay? Can stress affect your blood sugar levels? Absolutely. And what is stress to you? Stress could look, if you notice the picture, could be you could get stressed from headache, work, sadness, depression, even anxiety. All of that causes stress in our body. So our body responds to stress by increasing our hormones, right? We'll discuss that shortly as well. Stress can be positive. The response in our body can be positive or negative, but it also takes a physical, emotional, and interpersonal role, a response in our body. Okay. Um, it can make it harder to manage your diabetes. And what it does, we recommend that you check your sugar every um, 6 hours, okay? When you're sick. So we discussed stress, but we're going to get back to the hormones shortly. We're going to move on into illness. So if you get sick, you may notice that you may need to check your sugars more often. So this is what we recommend patients to do. We'll say check your sugar maybe every 6 hours if you're starting to feel a little bit of a cold. Now, let's say you go into a full-on flu, right? For example, or if you just get that really, really flu cold like symptoms where you have a high fever, you can't get out of bed, you have that muscle and body aches, we would say going on to more like a little bit of a severe type of illness. We want to recommend you check your sugar every 2 to 3 hours because that's causing stress on your body. So it increases your sugar, it increases your numbers, okay? And if you use insulin, we also recommend you test for ketones every 4 to 6 hours. We those strips are usually sold over the counter, and Sandra, correct me if I'm wrong, but it's you could check that at home as well. We like to mention to patients to do that. It's a urine test, okay, and the strips are sold over the counter. We also recommend patients to continue taking their diabetes medication. So what happens is if you become very nauseous, patients tend to stop eating and then they tend to say, oh, well, I don't need to take my medication anymore. If I'm not eating, my sugar won't go up. So usually when you eat, you'll notice there's a spike in your blood sugar. So sometimes patients will think, okay, well, if I'm not eating, my sugar isn't spiking, so I don't have to take my medicine for this time, for this moment that I'm sick. But that's actually very inaccurate. You do have to continue your medication for the fact that you're stressing your body out so much due to illness that your blood sugar will tend to spike. Um, Now, it can do the opposite effect to some patient. It's very independent on the person. So it may actually do the opposite. It may drop your sugar, but more frequently, more likely, it actually increases your sugar. And we'll explain to you why when we discuss the hormones. And please, if you have any questions, please feel free to include your questions in the chat, okay? I wanted to make just a quick mention. Over the counter medicines like aspirin, cough syrup, decongestants, they may raise or lower your blood sugar. So please, if you come across a sugar-free option, please use those. Um, there's different brands. You could take the store brand. You could buy. They do have specific brands for diabetics that we recommend you take during your illness. Okay, especially because they're sugar-free. So that was just a side note. Now, going back to the stress, what does it do to your body? You may have heard this term fight or flight. When you get scared, you tend to freeze sometimes, right? We all have different responses to that, but that's what we call fight or flight. You'll feel palpitations, you may feel scared, you'll start getting anxious and sweaty. That's the fight or flight mode in our body. In this particular fight or flight mode, in response, your body releases a hormone to give you that quick burst of energy, right? In case you need to run. These hormones also raise your blood sugar. So you have the fuel to deal with whatever immediate threat your body is feeling that is putting you in that fight or flight mode. And your stress can also cause your blood sugar to drop suddenly, and that's what we call the crash. Your hormonal surges that happen at that time, they cause extra insulin production, which is what causes the crash, right? So if that makes sense to you. Rapid spikes can also be followed by sharp drops. So we do have that moment where the stress hormone can immediately increase your sugar, but then because your body releases extra insulin, it will drop your sugar. So you'll have that rise and then that crash. Okay. Over time, the stress can lead to higher blood sugar levels, requiring more insulin from your body. Okay, if that makes sense. So it puts a bigger strain on your body. So stress is very complex. I wish I could tell you it's just one hormone. There's several hormones that play a bigger part. And that's what I'll go into the hormones on the next slide. But please, again, if you have any questions, feel free to ask, because I know this kind of tends to confuse patients. It's a lot of information, but once you understand that fight or flight will increase your sugar, and then your body releases extra insulin and can cause that sudden crash to drop it, then you start to understand it a little better. And these are the hormones. And I love this picture because actually Sandra helped me with this particular picture. How your body responds to stress. So if you look at the first picture, when stressed, the body prepares itself for fight or flight. That's your brain, right? We're working on that. Then the brain communicates to the adrenal glands and the liver. Wow, okay, she's getting stressed out. We got to work a little harder, right? The stress hormones that are released after that, we have epinephrine, adrenaline, glucagon, and cortisol. All of those can either increase your sugar or drop it. So that was what I just explained, but now it'll make a little more sense if we have the visual aid, right? So your brain tells your body, all right, they're stressed. Let's start helping her out. Let's start releasing all these extra little hormones that she may need, or in my case or that you may need to regulate your sudden increase in sugar. Then too much insulin, boom, it's going to drop your sugar, right? I hope that makes sense, but just think of it. All your stress, epinephrine, adrenaline, glucagon, and cortisol. And we're familiar, cortisol might be one of the hormones that you may have heard before, and I'll explain that to you as well. We're going to just briefly discuss, why do people with diabetes not take their medications? This is something that I hear often from patients, and I'm just going to give you a couple of examples of what we hear patients say almost daily. I have a hard time remembering when to take my diabetes medicine. I hear that often. Oh, I take it, I don't always take it in the morning. I'll take it in the evening, or maybe I'll just take it after a meal. Sometimes I do, sometimes I don't. I get busy. I walked away and then I forgot, right? That's very common. We also hear, I don't like taking medicine. I can manage it on my own. So maybe the patient has a few good days of regulated blood sugar numbers and, that's it. I'm cured. I don't need to take my medicine anymore. I figured it out. If I don't eat these many carbs, I'll keep my sugar at this level. I don't need medicine anymore. But little do they know, that's actually the worst thing to do. Not taking your medicine is just going to throw off your plan. It may increase it, may lower it, depending on the patient, right? So we never want to do that. I can't afford my medicines. That's very common. That's probably one of the most common statements I hear. But we do have programs where they make insulin affordable for patients now, and that I could also provide you with that information once we're done. I also hear a lot, I don't think my diabetes medicine is helping me. So then I tend to educate them on exactly what their medication does, what organ it works with. But medication compliance is very important. You should take your medicine the way the doctor prescribed it to you so that it could work, right? So missing doses throws the body off, and then you won't see a change in management in your diabetes, okay? My sugar has been good, so I can stop my medication. That goes hand in hand with, I don't think my diabetes medication is working, because they tell me, oh, it's been good. I don't have to take it anymore, okay? And then sometimes we have to continue. Well, actually, not sometimes. I really tell patients diabetes self-management is a daily task. So we do require, patients to follow up. I always let them know, ask as many questions as you can. We meet up once a month. We could definitely continue with that education, okay? Then I'm confused about how and when to take my medicine. So I remind patients, listen, you could always talk to your doctor if you need it. The pharmacist sometimes could even change the font on medication bottles, make it a little larger for patients that maybe have a visual impairment. Or listen, in my case, my glasses, right? I still can't see certain fonts. So I asked, the pharmacist can actually do that for patients. And you'll have a comment or a phrase like, I'm afraid of the side effects. So we do need to teach our patients about medication and side effects. I remind them, please ask your pharmacist if you have any questions as well. If I see them here at the hospital, I like to go over the side effects with them so they're not afraid. Patients will stop taking their medications because they're not familiar with the side effects, and they think, oh my gosh, this is too much. I have to stop the medication. But these are some of the common phrases that we've encountered when it comes to patients not taking their medication. So some of the reminders that I like to give patients: take your medication on time. Take it the way your doctor prescribed your medication. It is very important. I'll remind them, listen, set an alarm clock on your phone. Try to get into the habit of, if you set it at the same time for every day, after 21 days, it becomes a habit. It will become a continuous habit, and you'll just start remember to do it on your own. And also the infamous reminder, that weekly reminder. Now thankfully there's different versions of these pill bottles. If you don't like the Monday through Friday, or sorry, the Sunday through Saturday look, if you don't like that longer one, they have rounder bottles, and they even have one for a whole month if that's what your preference is, AM and PM. We like to remind patients there are several ways to assist you in pill reminders, taking your medications. We like to also say, fit it into your daily routine. If you're the type of person that you want to take it the minute you wake up, leave your pills at bedside. If you want to take it before you're brushing your teeth, perfect. Leave everything in a location that's an easy reminder for you. Also, taking your medications with meals, especially insulin. It makes sense if you think about it, right? You eat, you want to take your insulin prior to you eating so that it'll cover that sudden spike post meal, right? That's very important to remind patients as well, because again, part of medication management is taking your medications when the doctor prescribes it for you. So if you ate and you take your insulin in the evening, by that point, your sugar's already pretty high, right? So it'll be difficult to control your blood sugar numbers if you take your insulin whenever you remember, as opposed to when the doctor ordered it for you. Some other suggestions include, like I said, putting your medications in a pill bottle, setting a reminder on your alarm clock, but also start a buddy system with your friend. If you and your friend take medications, maybe even similar medications, hold each other accountable. Or even a family member. I put a friend, but even if there's a family member there, if you're in the household, you take blood pressure medications, hold each other accountable. I do that with my husband, who I am happy to say, and he won't get mad, he's on this presentation right now. We remind each other to take our blood pressure pills, and that's how we hold each other accountable. In the morning, we'll both do it together, and I feel that that's the best reminder, because sometimes I'm busy in the morning, and it happens. Life happens, right? So we want to make sure that we're holding each other accountable. And if you're able to do that, please do that. Now, storing your medication in the same place every day is also essential for you as a reminder. You won't miss your scheduled time because you know where your medications are. We also want to remind you, keep them in a safe place, away out of the reach of children, right? Because again, they'll see you taking something, they won't know what it is, and depending on the age group, they may think it's candy. So we want to make sure that we keep medications in a safe place, especially away from the sun. You can have medications in exposure to sunlight. So that's just a quick reminder, especially your insulin. Also, another thing with your medications, very important reminder, if you travel, because I just had this recently happen, if you travel and you forget your medications, right, what to do? You could actually call your medical provider, let them know you left the state, and if they would be kind enough to send your prescriptions to your out-of-state location. Pharmacists can send a couple of pills just to cover you enough while you're on vacation. That's very important for you to continue your medications. And again, it does happen, so please make sure you remember to take your own medications. Do not take a family member's medication, even if you're on the same medication. Please don't do that. There's a lot of things to consider, especially with insulin. If you're not routinely used to checking your insulin, you just want to make sure you avoid any potential medication errors. You want to make sure your medication is not expired. So just a gentle reminder on that, okay?
Nancy, one of our attendees is also suggesting or saying that we can also ask Alexa to remind us to take a
Yes,
medication.
that is a good point. Yes. And I forget, believe it or not, as an Alexa owner, that you
Yeah.
can set your notifications for the same time every day.
Mhm. And
Notifications. medications.
And you said something very important here, and you said, that usually takes 21 days, meaning 3 weeks, to get into the habit or of doing something. And I constantly remind patients with diabetes of the same issue with medications themselves. Like sometimes in the beginning, it can give you some side effects, and then you don't want to take them anymore because of the side effects. But
Very
you
true.
need to give your body some time, to adjust to the medications, especially if you've run with high sugars for a long time. If you start taking your medications and your sugars start going lower and lower, you feel it. And you might feel dizzy, you might feel that you have a blurry vision, things of that nature. And you have to give your body time, because some people just take the medication once or twice for 2, 3 days, and they're like, no, this is not for me. I can't stand it. But it's because your body takes time, to adjust to the medication and start healing. So I constantly remind them also that, it's actually a good thing that you're feeling that way, because then that means that you're responding to the medication. You just need to give your body time to adjust.
Oh, absolutely. That is a good point. Thank you for sharing that. Because we have to remember your body got used to living in a state of a high blood sugar number. So now, like Sandra said, the medication is starting to work. Now your body has to adjust to this new low sugar level. And I say low because it's just starting to find its normal balance within your body. And I also do love that Alexa reminder. Yes, just make sure you set it at a time that works for you. Currently, my Alexa likes to send me a yoga reminder every day at 7 a.m. And if you're not the type of person to wake up at 7 a.m., just know that it will be very loud. So set it up at a time that works for you, that you know you're going to follow through, and you may not want to throw your Alexa out the window because it's very loud. But that is a good recommendation. Thank you for that. And one of the reminders as well, to add to Sandra's point, metformin is one of the most common medications that patients start taking, and it can cause GI, meaning gastrointestinal stomach issues. And patients typically, that's one of the medications that I've noticed patients stop taking. And it does require a few weeks to adjust to your body. So to add to Sandra's point, yes, absolutely. Give your body time to adjust, because you cannot stop taking those medications and expect change to happen, right? So, along with the reminders, medication compliance, and those, and giving your body that time to adjust, that is the best way to continue your journey with diabetes. And on to one of our next topics here, sleep deprivation and blood sugar. There's a lot of patients that aren't aware that your sleep can really affect your blood sugars as well. And you would think, wow, I don't get that much sleep. I wonder why I feel what I do. Well, lack of sleep causes stress and inflammation in your body. You wouldn't think so. Maybe you don't feel anything, right? Not right away. But if you continue months down the line where with poor sleeping habits, you'll start noticing maybe your body hurts in the morning, you'll have headaches, right? Your body feels off. That's the stress and the inflammation in your body. Sleep deprivation increases insulin resistance, means that your body is going to probably need a little more insulin than normal to adjust to all these changes happening in your body. It increases your cortisol level. You may have also heard high levels of cortisol increases weight. It's a stress hormone. And it's more familiar. It may sound a lot more familiar to women because that's one of the hormones they like to tell us, you're going through changes, all your hormones are changing. And cortisol is usually the one that they mention the most. It's probably the most common. And you may remember from our previous slide, our stress hormones are epinephrine, adrenaline, glucagon, and cortisol. So cortisol is one of those hormones that also keeps us imbalanced, if you will. And then it reduces your insulin sensitivity as well. So if you notice, all the increase in these stress hormones can also what? Can also increase your sugar again. And all of that not only happens from fight or flight response, but it also happens from sleep deprivation. Okay. Now, a little reminder, if you see the picture on the lower left screen, this is a mask for sleep apnea. If you happen to notice that you are a well, you may not notice, but if a family member, someone tells you, listen, you're snoring way too loud, or your snoring is getting worse, that may be the first sign that you may require a sleep study test. You could tell your medical provider, doctor, I am not sleeping well. I feel fatigued all day. My body hurts. I'm stressed. That may be a sign that you may require a sleep study test, and the medical provider can order that test for you. It may be done in the hospital, or you may receive a kit to do a 3-day sleep study test. Why did I mention that? It is very important to make sure that you're getting an adequate amount of sleep. Not sleeping enough, or if you're sleeping only 4 hours a day, for example, just to throw out a number, it will cause all this stress on your body. And if you notice the two pictures on the right, the gentleman and the woman, it's 3 o'clock in the morning. The clock on the top says 3 o'clock in the morning, and the one on the bottom also shows 3 o'clock in the morning. That's typically the time that our cortisol tends to rise. And I've heard from patients that's the same, they wake up at the same time every day. So to add to that, that sleep study exam, if your oxygen, what that means is your oxygen may be dropping below 90, maybe even below 85% while you're sleeping. You'll notice you're gasping for air and you're finding that you're struggling to breathe in your sleep. And that's why I mention that, is because if you're not getting the correct amount of oxygenation in your body, especially during sleep, it will also affect not just your blood sugars, but it'll affect the rest of your body. For example, your blood pressure as well. So we want to make sure that we keep this in mind, because poor sleep also affects other things going on in your body, other comorbidities that you may have. This sleep study will let you know, and your medical provider, to if you need extra oxygen while you're sleeping. And it encompasses a lot of things. So that's why I put that picture there. So that if you have that, or if you know, if your loved one is struggling with their sleep habits, that may be one of the tests that you could ask your doctor for. Now, sleep hygiene is very important. What can you do before to sleep to try to get adequate sleep at night? One of the things the doctors recommend is staying away from your phone or TV at least 2 hours before sleep, turning all of it off, having a dark bedroom. So having what we say are blackout curtains, making sure you have a dark enough room, so that way in the morning the sunlight doesn't bother you. I've also heard, and my husband doesn't like this one, keeping a cool room. If you keep a cool bedroom, it will also help you sleep better. Now, cool, that temperature depends on you, right? Because I like a very cold room, 65, 67 degrees. And I torture my husband. I apologize in advance. But the studies do show that if you have a cool bedroom, blackout curtains, and you stay away from electronics 2 or 3 hours before you go to sleep, you can improve your sleeping habits and sleep better in the evening. Okay. So just a couple of recommendations, of course. Um, you could always check with your medical provider before trying anything, but keep that in mind, right? Also, no coffee after 3 or 5 o'clock. Caffeine stays in the system a little longer, and the older we get, we become just a lot more sensitive to caffeine. So if you're like me, someone that likes coffee, to drink coffee with every meal, you may want to reconsider when you're having your last bit of caffeine, right? Because that also may play a big part in keeping you awake, throwing you off, and then causing that stress and inflammation in your body that will increase your blood sugar. How can we combat all of these on a larger scale? Recommendation would be exercise. Now, exercise looks different to all of us, right? We all have different limitations on what we could do. And again, it takes 21 days to create a habit. So the first day starting is the hardest part. When people with diabetes exercise regularly, their cells become more responsive to insulin, which helps them keep their blood glucose levels within a target range, whatever target range your medical provider gave you. Now, what kind of exercise can you do? Well, we think about it. Regular physical activity, just a reminder, it improves your heart health, it supports your weight management, it improves your mood, right? Endorphins, dopamine, it makes you happier, makes you a much happier person, reduces your stress, which will help you with sleep, and it promotes overall mental health, your mental health well-being. So overall, it can contribute to a healthier lifestyle, but the biggest thing is you'll combat your stress. it'll help you with control your blood sugars. And the biggest one, of course, your cardiac health, right? Because that's a big thing. We keep in constant movement. We're promoting oxygenation in our body and blood circulation. So those are things that we want to keep in mind. Now, what can you do? I love this slide because anyone could do a little bit of each of these if you choose to. If you look at the top left screen, we have chair exercises. If you have an injury, or let's say maybe arthritis, this weather is getting colder outside, we may not be able to tolerate walking for long distances, you could do chair exercises. If you have weights at home, 2 pounds are enough, or if you want to grab a water bottle, use what you have at your disposal, right? And then you could just swing your arms around in circles, or do your arm raises to the front, do your arm raises to the side. And my favorite is lifting of the legs, which you can't see here, but even if you do maybe 2 sets of 10 or 3 sets of 10, it keeps your body in movement. And those are perfect chair exercises that are plenty of different videos are available on YouTube. It doesn't, you're not limited to age, but I find that the geriatric population tends to do these more because of arthritis, right? But if you happen to see that this works better for you, especially during the winter, absolutely go for it. The picture below it is a stepper. You could even do that at work. These not everyone has that, but it is an option for you if you're able to do that. Or even if you have a lunch break and you want to go up and down the stairs, especially here in the hospital, we love to do that. That also helps. You don't necessarily need to go outside. You don't necessarily need to go to the gym. You could be in continuous movement even when you're going to see, if you have that opportunity at work. Just take maybe 10-15 minutes, go up and down the stairs, of course, remaining safe from injury. That's also an idea. I've heard a lot right now. My patients were telling me they like to garden, and right now is probably the best time to rake leaves. Even that may not seem like anything major, but that alone, that is keeping you healthy. That movement, you may notice you have to work a little harder to rake those leaves. Absolutely, that's keeping you in movement. That's considered an exercise. My favorite is that top picture of the young lady with the gentleman dancing. Takes me longer to clean because I'm guilty. I will put some music on and start cleaning. So if you're sweeping or if you're mopping, that is also considered an exercise. Put on some music, whatever music you like. Take that extra 5 or 10 minutes to dance. I promise you, you're gonna feel it. You're gonna feel you're getting a little warmer. You're in movement. That counts. We also have the young lady on the top right. If you want to work out from home, you want to get an exercise band, or even just the simple stretching in your home, if you're able to, again, whatever is safe for you, that is also an option for you. Exercise will look different to every individual. Do what's best for you, do what keeps you safe. And if you need other ideas, absolutely, we have them. And if you have any suggestions for us, please let us know. But it's whatever you could do to keep yourself in movement. We say at least 30 minutes a day, and sometimes that's not a reality for people just because of the job or whatever job they do. But even if you're able to just go up the stairs once or twice, try that. Do whatever keeps you happy. Try moving as best as you can. Again, you don't need a lot. You don't need expensive equipment. You need the intention and the willpower to start your movement. And that is more than enough. Does anyone have any questions for us?
Well, thank you, Nancy, for all that information. Definitely, lots of actionable items, and that's exactly what we're looking for. I don't have any questions here, but I would like to ask a question on my own about exercise. People say aerobic exercise, other people say anaerobic exercise. Some people say you gotta walk more. Some other people say, no, you gotta do more weights. Sometimes it gets very confusing.
Mm-hmm.
So which one do you think is best in terms of diabetes control, or let's say for diabetes control?
So for diabetes control, we recommend starting with walking. So if we think about it, after a meal, what happens? Our blood sugar spikes.
Mhm.
So what we want to say, we want to try to burn off the sugar, if you will, right? Not trying to keep it as simple as possible. If you walk, even if you walk 30 minutes after your meal, that is a good starting point for you to keep control or manage the spikes in your blood sugar. If you live or lead a sedentary lifestyle, it's not going to help you. So if you eat and then you sit and you fall asleep,
Mhm.
right? Because again, remember, we're eating, blood sugar spikes. It may make you sleepy. It may happen, right? That what we say, the itis after a meal. That's why, because your sugar, it is increasing, and it happens to all of us, just some a little higher than others. It is recommended at least to start walking. Once you start building up a habit, if you choose to include more, there's no harm in that. Weightlifting helps with your muscle mass, also helps burn fat. But I do take into account that as we get older, sometimes it gets a little harder. So if you're able to start with at least walking after a meal, 30 minutes a day, that's a good starting point. Whatever you choose to add on after that, there's no wrong way. Cardio workouts are always good. Strength training is always good, but it's just, at least for a starting point, walking is a good place to start. Whatever you choose to add after that, it's just added benefits for you. Not that there's a wrong way of doing it.
Okay. Well, thank you so much. And then I don't see any questions from our participants, but what about the injections that are not insulin, also known as GLP-1s? What do you have to say about that? Because sometimes, people think it's an injectable, I don't have to use it, or it's once a week, and they might forget because it's once a week. Any recommendations for patients? We know that we can use Alexa now to
So
remind us.
your GLP-1s, if I'm not mistaken, you may have heard this before. It slows down your digestion, right? It's supposed to help you with your digestion, make you feel fuller longer, and also, but it's also helps maintain your blood sugar, right? So also another type of insulin. And if you may be aware, in our bodies, we have a pancreas. Our pancreas creates insulin, right? And depending on the type of diabetic that you may be, you may not produce insulin, or you may not produce enough insulin. So a GLP-1 is a lot more common to see being used these days, especially for weight loss medication, from weight loss reasons. But it was created with the intention to use for diabetic patients. They noticed how it was working for weight loss, and that's kind of how that started. So it does promote slower digestion for patients. Now, again, make it part of your routine. If it's one shot a week and you're noticing it's easier for you to take it at the beginning of the week, find a day of the week that works best for you. If you're exhausted by the end of the week and you don't want to deal with any more shots, I wouldn't recommend taking it at the end of the week. However, if you find that maybe, if you happen to be using it for weight loss as well, if you find that you're getting a lot more hungrier on your weekends and it works better for you to take closer to the end of the week, then please do that. You have to find the day or a way that works for you. I would love to tell you it's better Monday than a Friday. However, it is a very individualized approach. So you should find a day that works better for you, right? And your lifestyle, because some of us are just happen to be busier on a weekend or running around during the week because of school, work, family life, etc. So I wish I could tell you there was just one answer, but no, it's really, you have to find the way that works best for you, a time and day that works for you, since it's only a once a week shot.
Yeah.
Incorporate it into your medication management. And again, Alexa isn't a bad idea, but I would do Alexa along with maybe a cell
Mm.
phone reminder as well. Now the phones give you a daily reminder, but also setting up an alarm with the additional reminder. You're covering all your bases. I'm a big fan of the buddy system. So have a family member remind you, or you know what, even I'm very old school. I am pen to paper. So if you need to place a piece of paper on your refrigerator, remind yourself, take your shot on a Monday or take your insulin on a Wednesday. Sometimes the visual aids work. I live by visual aids.
Mhm.
So
Mhm.
just a couple of ideas. Maybe try those.
Yeah, well, thank you so much, Nancy, for doing this presentation, and I'll see you again tonight.
We'll do
For,
it again
for
6:30. If anyone wants a repeat, please join us this evening.
Yes, or maybe they would like to watch the recording later in community chats in YouTube. So thank you so much to our attendees for being here again. We just hope that this information is useful. And we're not going to be in community chats on Thursday because it's Thanksgiving, but the following Thursday, we're going to have, again, we're going to do some series. It's a two-part series of how to behave ourselves around people with autism. So I know that a lot of people have been asking me for topics on autism and how to understand autism. So here we go, autism in December. So I hope you join us for that one, and I will see you very soon. Thank you all.
Thank you all. Have a good
Happy
day.
Thanksgiving.
Happy Thanksgiving.